As crises and conflicts are deepening all around the world, there is an increasing need for humanitarian assistance. How can we help vulnerable communities? How can we support them to be stronger, more resilient? This is Voices for Resilience, the podcast of the Netherlands Red Cross. In this series, we will answer some of these pressing questions. How can we support vulnerable communities to improve their water access in regions affected by rapid urbanization? What can communities do to use water more responsibly? Hi, I am Marij Zwart, a water, sanitation and hygiene advisor with the Netherlands Red Cross. Join me and Faustina and Seb from Ghana Water Company and Ghana Red Cross as we dive into an inspiring story from Ghana, showcasing how a good partnership can tackle water accessibility challenges for the most poor. Imagine African cities. They are growing faster than ever. We can see rapid urbanization and a quickly growing population. Africa is home to the 10 fastest growing cities in the world. Due to this quick growth of cities, a lot of people lack access to the services like safe water and a safe toilet. This leads to public health risks like outbreaks of cholera. On top of this challenging situation, climate change, in the form of droughts or floods, increases the water related risks that people face. This raises an important question. What can we do to help? In Ghana, the Red Cross collaborated with the local water utility on a unique project in order to provide sustainable water access to poor urban communities. Before we dive deeper in this project, I'd like to show you the daily realities of the people without water. Seth Owusu, our dedicated volunteer, shares his first-hand experiences.
In the community where I work as a Red Cross volunteer, some of the challenges that we faced was that people had to travel long distance in order to get access to water. They need to travel barely 3 to 4 kilometers to get access to water from the neighboring streams.
I'm going to say water to my people. Water means life because the community is called Beposo. Beposo, which literally means on the mountain. So if you get access to water like streams, you need to descend this mountain, go to the outskirts of the community in order to fetch water. And the water that they were using, livestock were even making it muddy. And also during dry seasons, the water is not live. It doesn't flow well. So you go there and you see that many people wanted to get access to water, and the time you realize around 8 a.m., then the water has become muddy. You need to wait in order to get a spoonful of water for your household.
My personal experience before I would get access to water for domestic purposes, I myself had to travel to Insuta, which is one of the neighboring communities where there is a reservoir. I'll go there with my 20-liter gallons. I'll buy water and I need to travel back to Beposo. So that was a very great deal because the fuel that I used to buy outweighs the cost that I pay in relation to the amount of water that I buy. It is very expensive. It is very expensive as compared to the amount that one would pay when the person is connected to Ghana Water Company Limited. Someone will be paying not above 30 cedis, 20 cedis monthly. But for I to be buying water from the reservoir, 10 Ghana cedis. So a month will be barely 40 to 50 cedis. And it is not even sufficient for the household.
Faustina Boachi, who leads the Low Income Customer Support Unit at Ghana Water Company, the local utility that the Red Cross is partnering with, talks about other challenges.
Water is a human right, and everyone should have access to water services. And as a water utility, we have the mandate to ensure that urban residents in Ghana have access to sustainable water services. Our research has shown that more than 50% of urban residents live in the low income areas. And in the low income areas, you find that they are paying 5 to 10 times more for water that is not coming from the utility, of which the quality cannot be assured of. So it means that when people are not connected to the utility services, they pay more for water of dubious quality. And also, when people don't have access to water, they walk long distances. Some walk more than 30 minutes to look for water. And you know, water is usually fetched by women and then young girls. So it affects the education of the young people. And then the time that women can also use to engage in gainful employment or other economic activities, they use that time to look for water. Cases have been reported of young girls who have gone through sexual harassment and violence as a result of going to look for water. So the challenges of water go beyond the issue of affordability. It has social and even health effects, because if people are not drinking safe water, they fall sick from water related diseases. So not having access to water has challenges that goes beyond the economic challenges.
Growing up with the daily challenge of accessing clean water, Faustina was driven to make a difference. After joining Ghana Water Company, she challenged outdated views that the poor communities can't be good customers. She played a key role in establishing the Low Income Support Unit in 2013. The unit has since connected thousands of underserved households to water services. The household tap not only provides cheaper, safer, more comfortable, and more dignified water access, but also fundamentally changes people's lives, increasing their resilience. Just when it seems Faustina's unit reached a hopeful turning point with connecting poor people, they encountered an interesting issue. Despite the availability of improved water services, not everyone wants or is able to connect their house to the water network. What's stopping them?
Under our projects with the Red Cross, we decided to engage with the community members through a baseline survey to understand their needs, their aspirations, the challenges that they face, and what they really want, and what they would want Ghana Water and the Red Cross to do for them.
The survey and following workshops showed us why some residents are hesitant on getting connected to water services. Misconceptions definitely contribute to their reluctance. We found that people living in poor urban communities sometimes consider themselves too poor to have a water tap at home, a belief that undermines their basic human right to access clean water. However, as Faustina will further explain, the primary barrier for water access at home is financial. Even though people that are not connected pay a higher price for their water from informal private water sellers, the one time costs associated with getting connected, the connection fee, is often too high.
You know, affordability has always been a significant barrier for some households in these areas. The cost of connecting to JWCL's network, as well as the ongoing water bills, may be too high for certain households. We looked at the number of people that will be dependent on a particular connection. We found out from them what they want. Is it a standpipe? Is it a yard connection, a household connection? Is it a prepaid system that they want? And then we also looked at their willingness to pay for the connection, because these connections are not free. So we asked them, how much are you able to pay for a household connection? Are you able to pay 1,000 cedis, 500 Ghana cedis, 300 Ghana cedis? And most of the respondents said they cannot pay more than 500 Ghana cedis for a connection. And we created different scenarios.
After recognizing affordability as the main barrier, Ghana Water Company initiated a subsidy system covering 70% of the connection fee, which helped families in poor communities to more easily afford their water connections. The Red Cross contributed additional funds to this system and also adding 100% subsidy for the most vulnerable, which completely cover the cost of connecting to the water system. It sounds like we have a happy conclusion, right? But actually, securing a water connection is just the beginning. Just when we thought connecting homes to reliable water services would solve the problem, we faced a new challenge. It turns out keeping the water connection can also be challenging. Families who once paid much more for water from vendors and from other sources now sometimes struggle to pay their monthly utility bills. We wanted to know why. Insights gathered from Ghana Water Company and our workshops highlighted various challenges that families encounter in maintaining their water connection. The shift from paying small amounts for water daily, paying by the buckets, as we say, to a monthly billing cycle can be difficult, particularly for those without a steady income, as this requires saving. Many new clients do not fully grasp the billing system or know how to read the water meter, and therefore don't fully trust their water bill. To understand the water bill, people must also understand very well that the volume of water has a price, so that even when you have a tap at your house, you still need to use the water wisely and not let the tap running. Also, families in Ghanaian cities often live in compounds with multiple families. As a compound can only have one water connection, this means that these families need to share one water bill. This requires that compound neighbors organize themselves and agree on a process to pay and share the bill together. Recognizing all these challenges, it's clear we need to do more than just connect water taps. We started a series of initiatives to change how communities think about water and use water. This goes beyond just using water wisely. It's about understanding the whole system, from how we consume water to how we're built. Our goal was to ensure these water connections last by helping everyone become a more informed and responsible water user.
In order to reach out to the community, we use several channels like radio show, we use door-to-door visit, we use community information centers, which is like a small version of radio. Like they have pole with horns attached to the pole. So whenever they communicate something to the inhabitants of the community, they can get the information from afar. There is someone over there, like a radio personnel. The person will be broadcasting daily occurrences, some advertisement, and people will be listening to it. So we gave them jingles that we had made with regards to the project, and also we educated the host. Among all the communication methods, I personally think the drama session was the most effective one. The drama sessions was part of the community gathering or the community deba. The community deba, we provided tent in order to provide shade for the participants, in this case, the inhabitants or the prospective beneficiary to the project. So we called them on a given day. The people came in their numbers. We provide them with chair for them to sit comfortably. And after having lengthy discussion with them, clearing people's misconception, then we depicted drama session in order to consolidate whatever we have said to them, how to save, encourage saving habits, how to report illegalities, how to share bills collectively, and also how to use water. I do remember one of the title of the drama session that we depicted. It was Saga of Water. The plot started when a landlord by name Mr. Champon, based on the financial constraint that he finds himself in, decided to ask his tenants to pay fat water bills. One of the tenants by name Mr. Prince, in that case, I was that imaginary character, Mr. Prince, objected not to pay that amount unless I am being shown the bill so that I will pay. And one tenant who is by name Davi, a young lady, also a tenant, we collaborated. We told the landlord that unless he shows us the bill, we are not going to pay. During the performance, the audience were very amused. Their remarks were very positive. The way they were shouting, some were even jumping, clapping, especially when we were fighting with the landlord, because it is something that is very difficult to happen in real time. So they were very happy. So after the drama session, the master of ceremony called people to share whatever that they observed and some of the things that we could have done better. So that is when we have the chance to listen to what was on people's mind.
I believe that the volunteers play a key role. They have a good knowledge of the community. They know the challenges that they face. They are increasingly recognized by the community members. They respect them. They are their own neighbors. And so when they talk, they listen to them. They also bring on board unique competencies that you will otherwise not find in utility staff. They help to interface between Ghana Water and the community, which I think offers a good relationship for us to meet the needs of the community members.
As we reach the end of our pilot, we wanted to know what real changes did we bring to these communities. I've asked Seth to share some stories that highlight the impact of our efforts.
I think because of the behavioral change, there has been some success stories. One was a woman who came to my house personally to thank me because ever since she was born, she has never had the opportunity to connect her household to the water system. And due to this project, after going to her house, educating her for her to save, now she has access to potable water. And she just came to thank me. So she was very happy. After people have been connected to the water system, one of the events that I still recall and that gives me joy is that I saw a certain woman drinking the water for the first time and she was laughing. She was very happy. It's like she has had like a soft drink that she is drinking. I really saw great joy in her eyes. It's like she has had a jackpot win. Now that people are getting water and even storing some of them in their storage facilities like polytanks, it is something that they never dreamt of. It is something that if someone had told them that it would happen to them in some few years, they could have doubted the person. Now this dream has become reality. When I actually saw people connected to the system, I realized that this is something that has become a reality and I will have something to boast of. So I was very happy.
Seth's stories give us a vivid glimpse of the personal impact our project has had. But what does it take to keep this momentum going? Faustina will share her final insights on how partnerships play a crucial role in driving and sustaining these changes.
We cannot address all these challenges ourselves. And the Red Cross comes in to support us with resources and to also build the capacity of our staff, especially on the behavior change campaigns, to be able to reach those on the last mile. Communities that Ghana Water as a utility finds it difficult to reach. And we believe that a more active and visible presence at the community level is essential. I believe that through the dedicated efforts of the Red Cross, we are not only addressing immediate needs of community members, but we are also striving to create lasting behavior change and empower communities to be resilient in times of any crisis or emergency.
We all need to work together for universal access to water and sanitation services. No organization can do this alone. Also, the issue of access to water and sanitation is not solved through infrastructure only. A continuous service is required instead. Publicly mandated utilities are best placed to provide these services, and especially in urban contexts, are almost always present. However, especially in the global south, these utilities are often faced with serious challenges. For humanitarian organizations like the Red Cross, it is especially important to partner with, empower, and support these utilities to help them provide sustainable access to water and sanitation to all, leaving no one behind. If you want to know more about the project, read our online report called Hungry for Water at the Watson Mission Assistant website, watsonmissionassistant.org/ Ghana Urban Water. That's it for today. This was Voice for Resilience, the podcast of the Netherlands Red Cross. My name is Marij Zwart. It was a pleasure sharing these stories with you. Thank you for listening and stay tuned for the next episode.